How does sunburn history change skin cells seen under a microscope? Imagine looking at skin through a powerful microscope after someone has experienced multiple sunburns. You would see clear signs of damage that tell a story of repeated ultraviolet exposure. When skin gets sunburned, especially from ultraviolet B rays, the damage happens at the cellular level right in the outermost layer, called the epidermis. One of the most recognizable changes is the appearance of sunburn cells. These are keratinocytes, the main cells of the skin, that have been so badly damaged by UV radiation that they undergo programmed cell death, or apoptosis. Under the microscope, these cells look like dead or dying cells floating around in the middle layers of the epidermis. They often cluster together, showing how severe the damage was. In addition to these dead cells, you can see signs of inflammation. The tissue around the damaged cells becomes edematous, meaning fluid accumulates around the cells, creating spaces called spongiosis. White blood cells, especially polymorphonuclear leukocytes, infiltrate the area as part of the body's response to injury. Blood vessels in the skin also dilate, which is why sunburned skin often looks red and inflamed. Microvesicles, tiny fluid-filled sacs, can form as a sign of acute damage. All these changes depend on how much UVB exposure occurred and how susceptible an individual is to sun damage. Looking deeper into the skin, the outer protective layer called the stratum corneum can become thickened and laminated, sometimes taking on a gelatinous appearance if damage is severe. Vesicles filled with proteinous material may develop within this layer, originating from the underlying stratum lucidum. In the deeper parts of the epidermis, damage causes irregularities in cell shape and size, vacuolization or empty spaces within cells, and abnormal development called dysplasia. Zones of localized cell death, known as zonal necrosis, can also be seen. A significant change is the reduction in Langerhans cells, which are immune cells that help defend the skin. When these cells decrease, the skin's ability to detect and fight abnormal or damaged cells diminishes, increasing the risk for future problems. If sun damage continues over years, the changes become more profound and affect the dermis, the layer beneath the epidermis. Chronic sun exposure leads to a process called solar elastosis, where elastic fibers in the skin break down and accumulate abnormally. Under the microscope, this appears as amorphous, damaged elastic material that stains differently depending on its location. These elastotic masses can be pink or red in the upper dermis and lilac, or blue deeper down. Macrophages, the cleanup cells, gather around these damaged elastic fibers, containing coarse granules of debris. The collagen network supporting the skin also becomes disorganized, which contributes to the leathery, wrinkled appearance typical of long-term sun-damaged skin. Understanding these microscopic changes is essential because they reveal how repeated sunburns and chronic sun exposure can set the stage for skin cancer. The damage to DNA in skin cells during sunburns can lead to mutations that, if not repaired, accumulate over time. The reduction in immune cells like Langerhans cells hampers the skin's ability to detect and eliminate abnormal cells early. This creates an environment where damaged cells can grow unchecked, increasing the risk of skin cancers such as basal cell carcinoma, squamous cell carcinoma, and melanoma. Each sunburn adds to the overall burden of cellular damage, making the skin more vulnerable over the years. So, protecting your skin from sunburns is not just about avoiding immediate pain but also about preventing long-term cellular changes that can lead to serious health issues. Always consult healthcare professionals for personalized advice on skin health and sun protection strategies.